Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, Dr. Swain.
Hey, Stacy, how are you?
I'm great. Well, let's have a little fun today. I would like to know, and I think our listeners might like to know, a little bit more about you. Why are you a doctor? Did you always know you wanted to be a doctor?
That's a really good question. You know, it's been so many years, sometimes I have to sit back and think about how it all started, really. I always grew up around it, and so I was exposed to it a lot. My grandfather was a physician. My dad is a physician. My dad's a big role model to me. And so I grew up around seeing that, so I was used to seeing some of that stuff. And our conversations at home around the dinner table were a lot of, well, Dad, what'd you do today? Because we would all share what we were doing in school and stuff like that. And so he would, without violating anybody's privacy, would kind of tell us what he did today. And then my grandfather was a physician in New Orleans. And so I grew up hearing stories about all the stuff my grandfather did. Wow. So I grew up around it. And it was always kind of in the back of my mind. And then when you get old enough, you start kind of thinking about, okay, what am I going to do when I grow up? And I like the concept of doing something to help somebody else. You know, the hard part about being a physician is that it's a life of service. And some days it's like everything else. Some days it's easier than others.
But you're always a doctor 24/7, and you have patients have needs 24/7.
Right, and that's part of the lifestyle because it is a different type of lifestyle. One of my friends one time was telling me, well, it's okay if you're a doctor because you have people that cover for you when you're on call. When you're off, you're off. Well, you're not, because it's great if you can do that and turn that off. But the number of times that I wake up at 3 o'clock in the morning thinking about, oh, I got to do this, or I need to do this for this person. And I guess everybody does that when they're fields of work. But the good thing or bad thing about medicine is that you see people out there most vulnerable. You know, I've had people in my office that I've almost cried with. I've had people in my office that, you know, I had to fuss at. And so you're getting to know someone. It's very humbling to have people come in and look at you and say, I've got a problem, help me with this, and that you're going to cut them open or put them to sleep, and they're trusting you with their lives or their child's life or their wife's life to try to help them. And so sometimes that responsibility is overwhelming. You know, I've never really talk to my patients about those feelings because I have a job to do. Sure. You know, they're here for a problem and I'm supposed to help them. And we don't have time for talk about chit chat or stuff like that with me. But every now and then, you know, somebody comes in and they really touch you. I had somebody yesterday who came in who lost their spouse, and she was there for a sinus problem, and it was fine. But, you know, she was sharing with me because she just started crying. And so I can't walk out of a room to go see somebody else because I'm behind, because she's sharing.
She needed you to talk to her.
I needed to sit down and talk with her. That's a beautiful thing, but it is also really, really hard because you get home at the end of the day and you think, oh my gosh, you know, we were joking a few minutes ago, we're all going to pass away, but you see someone hurt, you really want to try to help them.
Mm. Well, let's go back to medical school.
Yeah.
What is medical school like?
It's a blur. You know, it is very intense 4 years where you're learning a vocabulary. You know, you get out of school and everybody thinks, you know, you're a doctor and you know how to practice medicine. When you get out of medical school, you know a vocabulary. You don't know how to practice medicine. That's what residency's for, where they teach you for however long your residency program is, how to go and be a doctor and actually take care of someone. And it is a tiered structure. It's residency is kind of like the military, for lack of a better word. You have your first year residents that are the privates. You have your second year residents, which are probably the corporals or the sergeants. You have your third year residents, which, you know, are probably the captains. And you have your fourth year residents, which are probably like the colonels and the majors. And then you have your fifth year residents who are chiefs, or who are the chief resident, who's probably like a 1-star general. And then you have the fellows. If you have a fellow, that's someone who's finished their residency, and they're like
They're the 2-star generals.
2-star, 3-star generals. And then obviously you have the attending who's kind of the head of the Army, so to speak, because he's ultimately the one who has the most training. And so medical services function like that because usually there is the chief resident telling what he wants done. And then the first-year resident, when you have questions, is talking to the third-year resident, or there's some kind of dynamic as to how that runs. But that's in a residency program. And so that's how you really learn how to take care of people. So
you did 4 years of undergraduate, 4 years of medical school, 3 years of residency?
5.
You did 5 years of residency.
And then a year of fellowship.
Wow. You were in school for a while.
Yeah, you're in school for a while. There's a lot of time, effort, and money spent on educating a physician. I was reading something the other day. They were talking about fighter pilots, and they were talking about with the drones that are now we all have and how much money it costs to train a fighter pilot. The analogy to training a physician is somewhat similar because you've got this length of time that is needed to master some information, and then you have to have time to practice what you've learned and learn how to employ it and when to employ it. The last thing that the chairman of the department wrote to me and told me when I left was he said, "You'll never quit learning." And he's right. That was one of the wisest things I've ever been told because you've never seen it all. Even when you think you've seen it all, you've never seen it all.
So how do you continue your education now?
There are a lot of options now. They send you course books that you have to go through, and you have to have so many certain hours of continuing medical education. There's a lot of stuff on the computer right now that you can start to do. I have some emails right now that I've got to go through because how physicians learn, how we're being taught is constantly changing. Medical school now is a whole lot different than medical school when I came through or when my father came through or when my grandfather came through.
Right. We know that you have a few children and one in college now, one about to be in college. Do you recommend to them to become doctors?
That's a hard question. I don't know that we had that conversation yet.
Well, in general, would you recommend?
I think you got to follow your heart. And that's what I would probably tell my children if they ask me about it. Or when they ask me about it, I'm sure it will come up at some point because they have grown up hearing the stories of my father and my grandfather and the things that I've told as well. And so I think I see a lot of young people who are interested in going into medicine. I have medical students sometimes that will come through our office or are interested in going into ENT and have asked about this. And so it's one of those things where it's not for everyone. There are different specialties in medicine. And there are different fields of medicine to go into, and so it's a big field, and there's a lot of need. But I think people have this perception that it's an easy life. It's a hard life. I mean, you're up all night in the middle of the night taking call. That takes a toll on your family. That takes a toll on an individual. So it is. It's a life of service. Some of my favorite TV shows are medical TV shows. Because,
really?
Yeah, I like watch. I wish it were
that glamorous.
I wish it were that glamorous. I really liked MASH growing up. I thought that was a great show. And some of the stuff they do was obviously not realistic, but some of the stuff they did was very realistic. I think those writers made a big effort to try to connect with their audience and to bring out some of the real issues that people struggle with. Now, it was a time of war, obviously, but the essence of that, of some of the struggles that they faced, I think that rings true.
Yeah. Do you ever host high school students?
I have in the operating room. The hospital, Spring Hill Hospital, has a program where I've had several high school seniors that we're rotating through because there's some great programs out there in high school that some of these young men and women were telling me about. So I've had several high school students come in the operating room and observe.
What's a typical day like for you?
It depends. There are days when we're operating and I'm in surgery, and there are days that we're operating in surgery and then have clinic afterwards, and then there are some days with just clinic. Invariably, it seems I'm always behind. I can never.
No.
Yeah, I can never. It's so frustrating because I never know exactly how long a surgery is going to take. I mean, you have some idea. This is a short operation or this is a long operation, and so trying to plan a day when people come in and you're on time and able to answer all their needs, it's difficult because there's so much uncertainty through the day. Like if you ask me what time I'm going to be home on Monday, the answer is I don't have a clue because that depends on who comes in, how much time they need, what's going on, how far behind I get. And the majority of of people, especially in clinic, when you're running behind, the majority of people are just so understanding because they understand that if they're sick and they need some extra time, we're going to spend time with them too. Occasionally, we have people that get frustrated with that process, and they're right. I mean, we try to be respectful of everyone's time, and no one wants to come to the doctor and have to wait. I almost love if we could have just boutique appointments. You need a 2-minute visit. You need a 20-minute visit. You need a 40-minute visit.
That sounds like a TV show.
It almost could be. I mean, I would love to be able to schedule the day that way, but it's just not realistic because I just can't throw a medicine at you and have you go out the door. In some ways, I wish I could because it'd be a heck of a lot easier on me and my staff, but you got to give people what they need. And being sick is not convenient. No one wants to be sick. Right. And the people are feeling bad, and when they're feeling bad, their tempers are short, or they don't understand, and they're upset, or they've got something else going on in their life. I mean, it is just one of those things that you have to really understand what you're trying to accomplish and how you're trying to help someone, because there's a lot of joy, especially when you have a home run and somebody has cancer and they're cured. I was seeing somebody yesterday who was just so grateful. She had a cancer in her sinus, and we'd operate on her. She had chemotherapy and she had radiation. And she was cured, at least at the moment. With cancer, you never know. It's one of those things. You're always looking for when it might return. And I was just so happy to be able to give her a hug and send her out the door. And then there are other people who had lost their spouse, and you have to give those people a hug and, just sometimes be willing to listen.
That sounds like a lot of stress, a lot of emotion. How do you take care of yourself?
I think I'm trying to develop some hobbies. I have a family and I'm busy at work. And so between work and family, there's not a lot of individual time. But one of the things I'm trying to start doing is I'm trying to start writing.
Oh, good.
I'm starting to try to write a book. We'll see if it ever really materializes, but I'm working on it. I think and this sounds kind of goofy, but I think you have to have a strong faith that there is some greater being involved. And for me, I have a strong faith in God. And one of the things I'll always remember is when I was in college and I was one of the scrub techs at one of the hospitals in town when they did that. I had a surgeon take my hand, and someone was opened up and put my hand on a liver, and the liver was completely filled with cancer. And he told me, he said, never forget this. And so, seeing how someone is put together and the struggles that people have individually, the only way you get through that is a belief in a higher power. The only way I get through that is a belief in a higher power. I think you have to have faith that somebody else is in charge and that it's all going to work out.
Well, my goodness. I knew this would be a good episode.
Well, yesterday I was fighting off tears after I saw my patient that lost her family. It was really hard because you see people suffer and you really want to help them.
Well, what I've learned today is doctors are human too.
Yes, they really are. They really are.
Well, let's end on a high note. Why don't you give our listeners, maybe some of our younger listeners who are considering becoming doctors, a couple of pieces of advice?
I think the first thing is decide what you want to do and don't give up. I was reading something the other day that said the average age of a medical student was older now. There are not a lot of medical students that are going straight through high school, straight through college, and then getting into medical school. Medical school is very competitive. Obviously, there are a lot of applicants for it. And if you don't get in the first time, it's not the end of the world. Don't listen to someone that says you can't do it. You can do it. You just got to decide if you want to do it bad enough and what it's going to take. The other thing I would say is there are a lot of frustrations in medicine in dealing with right now electronic medical records and obviously insurance companies and billing. There's a lot of change right now. There's a lot of social change going on. There's a question of, what are we going to do with our healthcare system as a country globally? How do we pay for that? And those kinds of things you're always going to be having to deal with, whether you're in private practice or whether you're in academic medicine, because there is a business to medicine. In the old days, people would be able to maybe stick their head in the sand and say, I'm not going to worry about that. You got to worry about that because your patients have to worry about that. If you want to get a test on someone and you're told the insurance company has denied that, well, why did they deny that? Did you not document it enough? Do you have to get on the phone and sit there and argue and fight with the insurance company? I've gotten better about that over the years. There's been several times where I've had a difficult conversation with the people that are representing the insurance companies about why a particular test needed to be ordered and why they weren't doing it. You got to stand your ground because you're the patient advocate. The hospital's not going to advocate for them. They don't know how to advocate for themselves. The insurance company is not going to be their advocate. So you're their advocate. And sometimes you have to fight the fights that they don't know how to fight. And sometimes you have to get them involved and you have to educate them how to fight. That all takes time. So no matter what the frustrations are, if you want to do it, don't give up. It's a noble profession, but you got to remember you're ultimately there because it's a life of service.
Well, I'm grateful that you are our friend, my co-host, and a doctor, because your heart is certainly in the right place.
Well, you're very kind. Thank you so much.
Thank you for sharing all that today. We'll look forward to the next one.
Very good.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.